For toddlers, over-the-counter OTC cough medicines are generally not recommended. The FDA advises against using OTC cough and cold medications in children under 4 years old due to potential serious side effects such as rapid heart rate, convulsions, and decreased levels of consciousness. Instead, safer alternatives include 1. Honey. For children over 1 year old, honey can help soothe the cough. A teaspoon of honey before bed can be particularly effective. 2. Humidifiers. Using a cool mist humidifier in the child's room can keep the air moist and ease coughing. 3. Hydration. Keeping the child well hydrated with water or warm fluids like broth can help thin mucus and soothe the throat. 4. Saline nasal drops. These can help clear nasal congestion, which might reduce coughing. Always consult with a pediatrician before giving any medication or remedy to ensure it is safe and appropriate for your child's specific condition.